Alberta recorded its deadliest year on record for drug poisoning with more than 1,700 deaths in 2021. Many disagree on the effective ways to reverse the trend. But a community-based research project into cannabis might have part of the solution. The impacts of cannabis use on mental health. What was the study? Erica Lemon.
So we did this project to understand the experiences of people in the community who were in risk. So we defined that as people who were using substances or people who were living houseless. We tried to get people who had intersecting factors. So that's why we focused a lot on different community organizations that AAWEAR had connections to, or finding people just out in the community. And so we did almost 200 surveys over a span of about 4 or 5 months. So it would have been last year. And then we did about 20 interviews, 10 in each city. So 10 in Calgary, 10 in Edmonton.
How was the research conducted? Lauren.
Our perspective as peers, we already can connect with our community. We know a lot of the folks out there, the underinvested folks in the community, and know how to speak to them. And when we were creating the survey questions, we made a lot of changes. We're like, wait a second, we wouldn't speak to our community that way. That could trigger them, or it could cause them to think that we were unsafe, or that we weren't to be trusted, right? So we already built that trust in the community. Already doing street outreach, peer outreach, Tuesday to Friday, we're out in the street, handing out harm reduction supplies, advocating for our peers. When we come up and we ask, hey, do you want to do a survey? They're more receptive.
It was my harm reduction when I was on the street. I didn't sleep a lot on the streets. When I did want to relax, I would smoke cannabis. Teresa.
To really make people feel comfortable, a lot of the questions were based on what that experience would be like, because when you're houseless, there's a lot of trauma that comes with that. You can get robbed, beat up on a daily basis. There's just refused access to all kinds of places. And really, how do you feel safe when you've been experiencing that for years and years?
Cody.
We didn't really single out any type of demographic. It was more random. Just, we tried to equal out the gender, whether it be someone with different pronouns, or she, her, he, him, or they, them. Give us more information on different demographics. We tried to do one-on-one, because a lot of the information that they're sharing is pretty private, and we want to be more intimate with one-on-one. If a person's houseless and they have no food, at the end of the survey, they would get a gift card. So it's a win-win situation. They help us. They help policies and practices. They help out maybe changing something maybe in the government. And also it helps them support themselves. Maybe put some food in their belly, or maybe get some toiletries or something, for themselves, right? So. And the smile on their face is priceless, right? After they're like, wow, I wasn't expecting this.
It makes me feel more comfortable to have a person understand what I'm going through, who has lived a similar experience as me. It feels safer.
So that's a big thing about peer research, is you do have to integrate a lot of additional support, which I think is just really important for the project and to develop rapport with the individuals. A big thing with community research is you don't just want to come in and do the research and leave. I feel like I have developed relationships with the people, people at today, people at Edmonton, through this project, and I think that's a very important component of community-based research.
What are the initial results of the research?
A good percentage of folks were saying they started marijuana just to help cope. Just to cope with their mental health issues. It wasn't on the survey, but a lot of them were using marijuana as harm reduction from opiates and wet meth, and basically just to cope on a daily basis.
And so what I noticed, themes that developed for myself, is the cannabis as harm reduction. So similar to what the peer researchers have said about utilizing it to come off other substances, that definitely was very prevalent.
If I ever see people going through self-destructive behavior with more dangerous substances, I will always suggest a strategy of harm reduction, such as trying easier drugs like cannabis.
People need to be more aware that mental health and marijuana is a huge issue. right? And and marijuana is not a barrier.
A community-based research project by AAWEAR, Habitus, and the University of Calgary. Mental Health Commission of Canada, mentalhealthcommission.ca. The views represented herein represent solely the views of the research team. Production of this material was made possible through the MHCC's cannabis and mental health research initiatives and a financial contribution from Health Canada.